Bronchitis. It is the inflammation of the upper respiratory tract which starts from the nasal cavity, pharynx, larynx, trachea, bronchi, and bronchioles, which ends in the terminal bronchioles. So it is a respiratory tract tree, respiratory tract or respiratory tree, which is meant for respiration of the human being. That is for inhalation and exhalation of the air, because air contains fresh oxygen which is necessary for the life of human body. So the intake of the air through the bronchi, that is the airways, into the air bags, where there is gaseous transfusion is performed, that is oxygen is absorbed from the walls of the air sac into the blood, and carbon dioxide is exhaled through these airways outside the body. So it is the oxygenation process which is performed by the lungs of the human body. So when there is infection in the acute phase, there is due to the irritation and inflammation performed or the done by the infections, that is the pathogens. About 90% of the acute bronchitis is due to the viral origin, but it may be caused by the bacteria and the fungi, foreign bodies, allergic bronchitis, and the air pollution, that is atmospheric and the surrounding pollution due to the insanitary surroundings and the living. There is pollution of the fumes, vapors, asbestos, nickel, arsenic. These are the elements which, when get entry in the body or in the lungs of the human body through the airways, that produces irritation, inflammation due to the reaction of the immune system of the body. Due to inflammation of this bronchi or bronchioles, there is excessive production of mucus, because this airway is lined by the goblet cells, which normally produces mucus in a normal quality, and they are also lined by the ciliary epithelium. So when foreign body, whether it is living or inanimate, that is a foreign body, that foreign body like allergens or the living pathogens, virus and the bacteria, there is a process of coughing. Due to this mechanism, the cilia and the mucus, they entangle, they capture the foreign bodies and try to expel out of the respiratory tract. So this is the normal physiological process of the respiration, especially the upper tract respiratory system. When there is acute inflammation attack of the bronchitis by the pathogens, living or inanimate articles like foreign bodies, allergens. Allergens includes dust, fumes, animal danders, pollens, especially in spring season, which is called as spring allergy, rhinitis, and the bronchitis. So these are the various causes of the or the etiological factors in the acute bronchitis. The symptoms produced during this acute phase of attack, there is chest pain, fever, tightness of the chest, there is persistent cough with mucus expectoration, myalgia, fatigue, palpitation, and also there is various processes, that is hoarseness, dyspnea, orthopnea, and the various breathlessness which lasts for about 2 to 3 weeks. So the acute phase is over within 2 or 3 weeks on its own if it is a viral one. When it is due to the bacterial, then we have to administer process of antibiotic therapy, whether oral or through the intramuscular or intravenous procedures. So the acute bronchitis is a curable disease and it can be treated easily by the symptomatic treatment. That is, if there is fever, we use the antibiotics. For pains, we use NSAIDs, analgesics medicines. When there is excessive or painful cough, we can use expectorants and the antitussive or the cough syrups. So these are the symptomatic treatment in the acute laryngitis and bronchitis. So it is a curable, but in this disease, acute phase of the bronchitis, we need, that is patient to be advised bed rest, plenty of water, and healthy nutritious diet, especially soup. Avoid the cold drinks, especially the smoking should be absolutely banned or the prohibited, advised by the healthcare provider.